All right, everybody, so we're going to go ahead and resume the conference. If you can take your seats. So our next speaker just arrived from the Sacramento area. She has come and given talks here before. She's also coming from CDPH, another veterinarian. And she's going to be talking today to us about animal bites and Capnocytophaga. Dr. Campagna?
Hi, everyone. Thanks for your patience as I fight the traffic to come from Sacramento. So today I'm going to talk about animal bites and Capnocytophaga, which is a bacteria found in the oral flora of dogs and cats and can be transmitted through animal bites. I want to start by saying that as a representative of CDPH, I have no financial interests or other relationships with manufacturers of commercial products, suppliers of commercial services, or commercial supporters. I'm going to start by talking a little bit about the incidence of animal bites, talk a little bit about a study that we conducted a couple years ago on emergency department visits that were due to animal bites, and then most of the talk will be about the study that we did on Capno. So animal bites can present a complex clinical challenge due to the resulting tissue damage that can happen, as well as the potential for infection. So we know there can be punctures or lacerations or possibly crushed tissue. And let's see, the infections that result from animal bites are often polymicrobial with a mix of aerobic and anaerobic bacteria. And the pathogens that can be seen often reflect the oral flora of what's in the biting animal's mouth, as well as bacteria on the victim's skin or the environment. So I have just a few examples on this slide of bacteria that are normally found on the skin that you can culture from skin wounds. Oral flora, Pasteurella, Bartonella, which we know can cause cat scratch disease, Streptobacillus, rat bite fever, and then Capnocytophaga, which I'm going to talk more about. We know that Clostridium tetani spores can be found in the environment and then be inoculated into bite wounds. And then rabies virus, of course, is one of the more well-known potential pathogens that can be transmitted through an animal bite. So in the US, it's estimated that about 4.5 million dog bites occur every year, and about 20% of these victims seek some kind of medical care, not necessarily visiting an emergency department, but some kind of care. Dog bites are the 9th leading cause of non-fatal emergency department visits for children aged 5 to 9 years of age, aged 5 to 9 years, and it's in the top 20 leading causes for all other age groups. But less information is known about cat bites. And so extrapolating those national numbers to California, we expect about 560,000 dog bites to happen every year. But we do see only about 36,000 dog bites and 8,000 cat bites reported to public health officials every year. So California regulation requires that a bite from any animal that is susceptible to rabies, so any mammal, be reported to the local health officer. And this regulation applies to any area declared as a rabies area in California, but for the last 40 or so years, that's every county. This graph shows the last 30 or so years of data we have on bites that are reported to public health officials in California. So you can see that dog bites comprise the majority of the bites that are reported, with about 30 to 40,000 bites per year. So next I'm going to talk about the study we did on emergency department visits due to animal bites. This was a pretty long study. It took many years to complete. And the goal was to look at the clinical and epidemiologic features of people presenting to emergency departments with a cat or dog bite injury. We found that there were about 35,000 emergency department visits every year, there were higher incidence rates for younger persons, males, and white and black persons. And children under 10 years of age were more likely to have bites to the head, the face, or the neck, which is pretty understandable if you consider the size of children. They're closer to the face of the animal. And there were about 6,600 cat bites, emergency department visits due to a cat bite injury. And we saw highest incidence rates in older persons, females, and white persons. During this 15-year study period, we saw 27 fatalities related to cat or dog bite injuries. And just comparing that to the burden of disease we get from rabies, there were only 3 fatalities due to rabies during this time. So, sort of spurred on by the study we did and thinking more about animal bites, we decided to really build up our web content that we have on animal bites. So this is a screenshot of our Vet Public Health section webpage, and that's the section that I work in, to provide information to the public on animal bites. So there's a little bit about bite care, but that's not really what we want to focus on. We want to focus on prevention. So there's a lot of good information about prevention, including tips for how to safely interact with dogs and cats. And something that we're very, very proud of in our section is our dog bite coloring and activity book. This is something that I don't remember what year it was developed, but it's very, very popular. It has a lot of good information, really accessible to younger audiences, talks about canine body language, and gives tips on how to, interact safely with dogs. And we send this out for free to local health departments, schools, healthcare providers, anyone. We want to make it really accessible to everyone for free. So just putting a plug up there. If you want to request any copies, let us know. You can also just search CDPH Vet Public Health section and find your way there. So moving into the Capnocytophaga case series that we did. So this was a project we completed last year, and it was a sort of a joint project between our state reference lab and our infectious diseases branch, which is the branch where I work. And the case series looked at the clinical and epidemiologic features of the patients from whom Capnocytophaga were isolated by our state reference lab. So many people have not heard of Capnocytophaga. It does occasionally show up in the popular press with very sensational headlines. Like I mentioned before, it's a bacteria found in the oral flora of normal, healthy dogs and cats, but can be transmitted to people and potentially cause severe illness. So they are commensal to the oral microbiome. There are 9 species in the genus, and they're basically divided into zoonotic and non-zoonotic species. The non-zoonotic species are found in the human oral flora. Zoonotic are found in the oral flora of dogs and cats, and they can be shed found in the saliva, and so transmitted through a bite or even just a lick or a scratch. And this is the group of Capnocytophaga bacteria that we're most interested in because we like to look at the zoonotic pathogens for that intersection of animal and human health. So there are some pretty wide estimates for how many dogs and cats carry Capnocytophaga normally. Some estimates will show 3/4 of dogs or about half of cats will carry Capno. There are a lot of pets in US households. It's estimated about half of households have a dog and a quarter have cats. So you would think that this is something we would hear about more often, but it does seem to be reported very rarely, especially how it's presented in the popular press. However, it's not mandated reportable to public health, so we actually don't really know how often it happens. It's like many infections, you can have clinical manifestations ranging from more sort of localized, superficial skin infections to severe disease. And in the literature, Capnocytophaga is often associated with sepsis. A lot of the case reports out there are cases of patients with sepsis from whom Capno was isolated. So because of that, we see case fatality estimates of 13 to 30%. And it is most commonly found or detected in people with weakened immune systems. This is not surprising. The people you might expect to have more severe infections. And in the literature, it's associated with patients who have had a splenectomy or a history of alcohol use disorder. So our case series was designed to look at the patients, like I mentioned, from whom CAPNO were isolated from blood or any other clinical specimen at our CDPH microbial diseases lab, which is our state reference lab. So Capnocytophaga, also, like I said, is not mandated reportable to public health. There's no database we can refer to look at these patients. But local public health labs and clinical labs will sometimes send isolates to our state reference lab for confirmation. And we had seen enough of these cases over the years that we thought, let's just do a case series and see what we find. So we were going to look at a 17-year period from 2005 to 2021. So we know the isolates are submitted by local public health labs and clinical labs for confirmation. So we started by looking at the lab submission forms that were sent to MDL. And some of these submission forms were accompanied by excerpts of medical records, which was great. Very few had that, but it was really nice to have that extra information. And we tried to leverage other public health data sources that we have access to. So there is a California Department of Healthcare Access and Information, which manages two databases that we utilized. There's the Patient Discharge Database, which shows coded records of everyone who is hospitalized in California, and the Emergency Department Database. So that's anyone who came to an emergency department in California. So we took the patients from the lab submission forms and tried to find the matching records in the HCI databases. And that would be to help us supplement with any information on comorbidities, because those databases have ICD-10 codes that list lots of different really interesting clinical information. So over the 17-year period, we saw 48 specimens from 47 patients with confirmed Capnocytophaga. They were submitted from 10 different local public health labs and one clinical lab. And I don't know how easy it is to see. On the right, we have a map with little dots showing where the labs are based. So clearly very heavily biased towards Northern California, but some in Southern and Central California. So this breaks down, we were able to identify the species of Capnocytophaga in nearly all of the isolates. And this table shows the number of isolates by the species. So the most common species was C. canomorsus. So that and C. cyanodegmi are the two zoonotic species that we saw. And then there were two other species of non-zoonotic. And for the rest of the presentation, I want to focus on the zoonotic category. Like I mentioned before, that's the category that we're most interested in. It's kind of hard to compare the two categories because there are only 4 in the non-zoonotic category. So looking at that subset of zoonotic species of CAPNO, the median age of the patient was 67 years, 60% were male, and about half of them had a pre-existing a condition associated with a depressed immune system. The most common comorbidities were current malignancy and diabetes, but then we did see history of splenectomy and history of alcohol use disorder, which are the conditions that we saw in the literature. This table shows the different clinical presentations. So the most common presentation was sepsis, which we expected. There were also skin and soft tissue infections, and I won't read them all out to you. You can see on the table. During this time period, there were 5 fatalities. All of them had C. canomorsus and died of sepsis. And this is just a pretty small table showing the specimen type. So the most common specimen type that CAPNO was isolated from was blood. And looking a little bit more into the animal contact for these patients, because that was what we were really interested in, 14% of patients reported sustaining some kind of animal bite, mostly dog bites, and 7% of patients reported owning a pet but did not report a dog bite. I'm going to talk a little bit more about the limitations of that information in a bit. So in the end, the findings we saw related to demographics, clinical history, clinical presentation, and fatality were pretty on par with what we've seen in the literature. What was most interesting was the few patients who actually reported a bite or some kind of animal contact. There are a lot of limitations with this study. The information we have was limited to public health data sources. The note section on these lab submission forms, there might be a big section for free text, but the amount of information we got on that form varied significantly. Some people gave a lot of details, which was great, and some people had just put the bare minimum. So we didn't have a standard set of information for each patient, unfortunately. In theory, the completeness and accuracy of the coding in our HCI databases could have varied as well. So certainly any kind of future studies that want to dig more into clinical presentation and all that, I think would benefit from a review of medical records, which we just didn't really have access to. We had the excerpts of the ones that came with the lab submission forms, but that was just for a few of them. Animal exposure was not a field on the lab submission form. Not surprisingly. The person who completed the form may have noted animal contact only if they thought it was relevant in this particular case. So because Capno is a commensal organism and pets may appear healthy, the significance of Capno in a pet may be underappreciated. And not surprisingly, people may not have reported a bite, but the bacteria could have been transmitted through a lick or some kind of break in the skin. So they may not have recognized an actual opportunity for transmission. And finally, it's unknown what proportion of all presumptive isolates were forwarded to our state lab. We know it's only 10 public health labs and 1 clinical lab, so it's just a small subset of the labs in the state. So we don't know how much they captured and how representative of the state our subset was. So just something else that we recognize. Here are a couple takeaways. We know that Capnocytophaga has the potential to cause very severe disease in people, especially those who may be immunocompromised. Could be an under-recognized cause of infection in people who have contact with dogs and cats. And I think an important takeaway is that healthcare providers can consider sort of pet ownership or contact with pets as a risk factor for certain infections instead of relying on someone to offer a bite history. So this is important for healthcare providers to be aware of. Veterinarians can certainly educate their clients. They don't know the specific patient's medical history, but they can at least talk about how to safely interact with their pets. Can provide some guidance. If you are immunocompromised, be careful. I just wanted to end by acknowledging my co-authors on this paper. There were people that did a lot of work on the epi side and the lab side. Our lab staff actually retested all of the isolates when we were doing the study because lab techniques evolve over time. There are new species of Capno that are identified, so we had to actually reclassify a couple species along the way, but they all fell within the same zoonotic category. And this paper was published in Zoonoses and Public Health. It's not open access, but I have a link so I can share it with anyone through email. So if you're interested in this paper, let me know. I love this picture. Thank you. Thanks for your attention. I guess I can take any questions. You can email me later if you think of a question.
Antibiotics of choice for the human?
Oh, I don't have that on hand. sorry. It's in one of the papers that we wrote, but we try not to make too many like clinical recommendations because we know that's not really the role of public health as much. Want to leave that to your discretion.
Hi, my name's Amy, and I'm one of the staff of Communicable Disease Control for San Mateo. I had a question about how you test for it. Is it a serology? Is it a PCR? Is it a culture? Like, how is it identified in the lab?
Culture, and then they do PCR on the
Okay,
isolate.
but there is PCR available for it.
Yeah.
Okay, thank you.
Yep.
Hi. I just was wondering, is it new information that Campagna is transmitted by licks versus bites? Only I haven't reviewed this topic in a long time, so not working in the emergency room at the moment. So, is that new information? I'm just it may be my own lack of knowledge, but I think it's an important point that we wouldn't think of as clinicians.
Yeah, I don't know if that's new information. I think maybe over time we start to recognize that, but yeah, I'm not sure. I think it's still associated with bites, so we need to be aware that it could be transmitted through licks and not just bites.
I have a question related to animal bites. So sometimes in city control, we get calls from people coming back from, say, Thailand or Southeast Asia, and they say, oh, I was in one of those places and I was bitten by a monkey, and so I'm worried about rabies. And so usually we tell them, yeah, but we're not so worried about rabies as we're about herpes B virus. And my understanding is that when people are bitten by a monkey that is infected with herpes B virus, that the virus can go and hide in the ganglia, and that it can come back years after the exposure, sort of like rabies. Can you tell us a little bit about this? And then what's the incidence of herpes B virus in wild monkeys as opposed to research monkeys? Do you know? It's a multiple.
I know. Yeah, we're building up our information on our website for non-human primate bites because that's a really common question that we get. I don't have any stats off the top of my head, so I don't want to speak out of turn and give you the wrong information. Yeah, I'm sorry, but I can email you more.
Okay, yeah,
more
that'd be great
information
because
later.
this is something that we sort of like we have questions, and I haven't found really a good answer for
Yeah,
people who are like
yeah.
worried, like it's something like I need to worry for the rest of my life. Do I need to get tested? Do I need to get titers? What do we do after being after that exposed in Thailand, for instance?
I know for research animals, they can either be imported from, Asia, in which case you just sort of have to treat them all like they have herpes B potentially. My husband is a lab animal vet. He used to work with primates, and that was a real concern of his. So that's what he would tell me. You just have to assume they all have it. But there are some that are raised in captivity, and I think, are actually screened. Sort of depends on the facility. Yeah, it's hard to say.
Thank you. Any other questions? Yeah.
Good morning. My name is Youssef. I'm a pediatrician and the chief medical officer here at San Mateo Medical Center. As I hear this presentation that we're going from thinking of bites to potentially just saliva, gets me also thinking of our recommendation changes over the couple decades about rabies and bats specifically. It used to be that it would be only if you knew you had a bite, and the recommendations are even if you were in the same room as one but didn't know you had a bite. Is that something that maybe is a trend that we're seeing maybe with dogs or other animals as well?
Sorry, so with rabies being concerned with transmission with just saliva instead of a
Well,
bite?
not just
Or-
saliva, but that people, going back to like the history is inconsistent, that maybe people either didn't know that they had a bite or weren't aware of the bite, but that because of the potential much poorer outcome with rabies, as well as these, that people should still at least present clinically to be able to screen someone as a risk factor, just having been exposed to or seen a bat.
Yeah, I think that's a really good recommendation. There's an MMWR coming out soon on 2 recent rabies cases in the US. One was in California, and I think one's in Minnesota. And it's basically highlighting cases where people had a bat bite or bat exposure and didn't recognize it. Or they knew they were bitten but didn't think it was significant because they didn't see a bite. So yeah, it's really unfortunate how those cases turned out.
Excuse me. Are you aware of the situation where sometimes cat scratch fever and malignant melanoma biopsies of lymph nodes get confused?
No, I don't know about that.
It's in the literature, and I experienced it with my dad many years ago, and I remembered it, and I just looked it up, and it's still there. Sometimes the labs are confused.
That's really interesting. Yeah, thank you.
Questions? Is this working? Yeah. So thank you, Dr. Campagna. So we're going to go ahead and take a break. So hopefully lunch is ready for you guys outside. And so we're going to take a break and can be back here at 1 o'clock. Okay. Thank you.